drugs will have no effect on reversing diabetes. However, there is new data that says there's something that can reverse diabetes completely. It's called the zone diet.
Hello and welcome to the Wellness Zone podcast, where we discuss the science of wellness, metabolism, and the dietary pathways to maintain them. I'm Mary Perry, and I'm here with Dr. Barry Sears, and today we're talking about a comparison between the zone diet and Ozempic for controlling blood sugar and diabetes. So, Dr. Sears, let's start with some of the basics. We know the prevalence of diabetes is on the rise in the United States, but what kind of numbers are we talking? How many type 2 diabetics do we have in the U.S. right now?
A lot. Now, what's a lot mean? It means about 38 million Americans are diabetic, and that's about, maybe 11 to 12% of our population.
38 million, that's wild. What about prediabetes? We know that's also on the rise as well.
Well, that's even worse. There's about 100 million Americans who have prediabetes. And why is that bad? Because a person who has prediabetes, they're 5 to 10% likely to convert to type 2 diabetes within about 5 to 10 years. And so we have a big growing population who will soon be diabetics, which really overwhelm our health system because it's diabetes that's the most costly drug or disease condition to treat in America.
So Dr. Sears, we know that diabetes is often a starting disease for other ones. So what other conditions or chronic diseases are associated with diabetes?
Just about everyone. Let's talk about two in particular, heart disease and Alzheimer's. If you have diabetes, you're 4 times more likely to get heart disease. If you have diabetes, you're twice as likely to get Alzheimer's. So again, this growing epidemic of type 2 diabetes does not augur well for the future of American healthcare.
So now let's dive in a little bit to Ozempic. We're familiar with Ozempic and its role in weight loss, but it actually has a connection to blood sugar control and diabetes. So can you talk a bit about that?
Well, Ozempic was developed as a treatment for type 2 diabetes. Now, when you have type 2 diabetes, your levels of insulin decrease. So you use drugs like either injecting insulin or other drugs that will basically increase the production of insulin from the pancreas in a goal to drive down blood sugar levels. They say, whoa, but I'm told that if you have lots of insulin in the blood, you get fat. That's true. So what they found out with Ozempic, if I go to higher levels of Ozempic, really toxic levels, then basically I can shut down hunger. So that became the popularity of Ozempic, not to treat type 2 diabetes, but to shut down hunger. So again, it was the type of thing, but a lot of side effects come with that, and that's why about half the people who basically start Ozempic stop after 1 year.
So Dr. Sears, it actually works to increase the levels of insulin in the blood and thereby also help with weight loss?
Well, no, actually the insulin in the blood will make you fatter, but basically at the higher toxic levels, it shuts down hunger in the brain, so you eat less calories.
It's crazy. So
So
what's its role in curing diabetes?
Well, it can't cure. It doesn't. No drug can cure diabetes. They can help manage the symptoms of high blood sugar, but they do not cure diabetes.
Mm-hmm. Now, what about in terms of reversing some of the symptoms of diabetes?
Well, again, I said drugs will have no effect on reversing diabetes. However, there is new data that says there's something that can reverse diabetes completely, 100%.
Let's hear it.
Well, it's called the zone diet. And these were very careful studies done at the University of Tennessee. And they took people who were already diabetic and put them on the zone diet, and where they basically provided all the food. And so after 6 months, following the zone diet, which is a calorie-restricted diet, but the food's being provided for them, what percentage of the people do you think basically reverse their diabetes completely?
All of them.
Correct, 100%. And so again, drugs do not basically reverse diabetes, but the zone diet, taken at the right dosage, at the right time, over a 6-month period, does reverse diabetes. That you take to the bank.
So Dr. Sears, can you explain a little bit more for people who aren't necessarily familiar with the zone diet as to what it looks like and what it entails?
Well, in many ways, it's very similar to what your grandmother told you to eat. She said a couple of things. First of all, you have to eat all your vegetables. That's one of the key things of the zone diet. You have to basically reduce what's called the glycemic load, and the easiest way is to eat lots of non-starchy vegetables. But you also have to take adequate levels of protein. Now, this is also important, that study I just talked about, because on those taking the zone diet, even though they're restricting their calories, their lean body mass actually increased, just the opposite of Ozempic. So what you need a balancing of protein and what's called the glycemic load, and if you can maintain that, then basically you begin to reverse chronic disease states, such as diabetes.
So one thing I just want to point out, because I know we're talking about diabetes, Dr. Sears, but the one of the things with weight loss when people go on these diets is that they do lose body mass. And I know that is a common side effect from Ozempic. So I just really want to mention that, to be on a calorie restricted diet, get adequate protein and gain lean body mass, like this is really huge, from the benefit of the zone diet.
Well, it's really the holy grail. The fact is, this is why when people stop taking Ozempic, as mentioned earlier, they do after about 1 year, they regain the weight. They don't regain the loss of lean body mass. They regain the weight as fat. So now, after you stop taking Ozempic, basically you're in a worse situation than before you started. So again, what you have with the zone diet, if used correctly, you lose fat, you gain muscle. That's the holy grail of basically diet.
And the other thing too, this study really just looked at the diet. So now with the components of using fish oil and polyphenols and the metabolic engineering program, you really are just extending the benefits that go with it.
Exactly. You're building a much more cohesive, really dietary system to change your metabolism. Now, what does that really mean? You're changing the expression of your genes. That's a powerful statement. So the more things you can add to the zone diet as a foundation, such as the omega-3 fatty acids and the polyphenols, you even get greater results. That means all those other diseases we talked about earlier that are associated with diabetes, such as heart disease, Alzheimer's, infertility, they, using the full system, also have the likelihood of possibly being reversed.
Mm-hmm. And that's the thing. These conditions are big concerns, especially as you age. So if you can do anything in your power to control blood sugar now and, hopefully prevent some of these things or at least delay the onset, I mean, it's a no-brainer.
Well, and that's one of the things. That's why we have science. We can have bloggers saying, I think, but say, what does the science say? So if you can cure diabetes just using the zone diet, just think of the possibilities of what you can do using metabolic engineering, which the zone diet is the foundation of, but only one component of the 3 components.
So Dr. Sears, if people are following metabolic engineering, and at the end we'll tell people where to go for more information, but what can they look for? How do they know that they're doing it right? Or what sort of blood markers should they be looking at to determine I am in the zone and I am doing this the right way?
Well, let's look at the first subjective marker. What's your first marker you're doing it right? I'm not hungry. Mm-hmm. Okay, I'd say that's a good start. But then that's why we look at science. Show me the data. What's in the blood I can look at that I'm doing it right? You can look for a marker called of insulin resistance in terms of called HOMA-IR. These are measures of basically how effectively your metabolism is taking blood sugar out of the body and bringing it to the appropriate tissues. So that will go down. How quickly? It turns out about 3 days. Say what? Yeah, 3 days. Now, that's assuming that's good if you're following the zone diet for the rest of your life. That's the rub. So again, you can reduce insulin resistance in the blood within 3 days. You won't be hungry within 3 days, but if you want both those to continue, you have to follow the zone diet for the rest of your life. It's like a drug.
Mm-hmm. And don't forget, you're going to lose excess body fat while also gaining muscle mass. So
basically, it can't get any better than that.
So, Dr. Sears, if people want to learn more about the zone diet and metabolic engineering, where should they go to learn more?
Well, again, there's a lot of science behind the zone diet. I would recommend going to drsears.com, where we try to explain the science in easy to understand terms, but also the implications of what this has for the future of medicine in America. Now, if they want to use the products that make it easier to follow the zone diet, then I'd go to zoneliving.com. So you have to have the understanding, show me the science, and then say, show me how to do it as easily as possible. Because I have to think, I'm going to fail.
Mm-hmm. Well, Dr. Sears, thanks so much for joining me today and for your time.
Thank you so much.